health initiatives, of course, today the first media rollout to get you ready for the dengue season, the minister and ministry being proactive in that regard, and we welcome, I would safely say, the most visible minister who takes time to not only join us on the Zoom line, but more than likely he will actually come on the set live. So he's here with us this morning, Minister of Health, Terrence Deyalsingh. Good morning to you, sir.
Good morning, Jason, and good morning to all your listeners and viewers, wherever you are. Good morning.
Of course, and we welcome our Acting Specialist Medical Officer, Osafo Fraser. Dr. Fraser, great to have you with us this morning.
Same here, nice to be here.
So I recognize today you say it's a media rollout. You'll be doing your media blitz, getting folks ready for, I would imagine, the rainy season and what comes with the rainy season, which is that threat of dengue.
Yeah.
Give us some more details.
So the rainy season is both good and bad. One, we need the water, but two, with the rainy season, you get an explosion in the number of Aedes aegypti mosquitoes breeding in and around your homes. So we always start this, as you put it, media blitz months before the rainy season to sensitize people for the need that a primary responsibility to control the Aedes aegypti, the primary responsibility is that of the homeowner. Because unfortunately, the Aedes aegypti mosquito breeds mainly in clean, clear, stagnant water, which is found in and around your homes. Now, that's a distinction that I kept and talking to the media about last year, because unfortunately, opposition corporations were taking the media to dirty, mossy, green, overgrown drains and pointing to that. And the media facilitated that type of misinformation. And Jason, we lost about 6 weeks in the battle against the Aedes aegypti, combating that. So I'm appealing to two sets of persons this morning. One, the media, that the corporations that point to these drains are misleading you. That's a health hazard in a different light. But the owner of your home, for instance, who has a toilet tank with no lid on it, that is where the mosquito breeds. Mm-hmm. The owner who has a bucket with no lid on it, that's where the mosquito breeds. The owner who has plants, bromeliads, that's where the mosquitoes breed. So I really want to urge the population that this fight is a partnership between government and the homeowner. And that's important.
Of course, and by all means, we will elaborate on that. I want to bring Dr. Fraser into the discussion as to the impact and the red flags one needs to look out for. And obviously, when you recognize that there is a particular symptom, you need to probably check in, because I know dengue is not only very serious, it's very deadly.
Correct. So the good news and the bad news is that most people who get dengue will be asymptomatic. But the bad news is that the really bad sides of dengue come after you start to feel better. You get your first week of symptoms, fever, headaches, body pains, and so on. And then the fever dies down and you start to feel a little better. That is when you have to start to look out for what we call warning signs. And those warning signs tell, okay, we're about to head into a different phase of the infection altogether, and that phase can be very serious. So what are some of those warning signs? Things you're looking out for would be things like bleeding, lots of vomiting, lots of belly pain, excessive tiredness, and of course the bleeding can be bleeding from the gums, or you find bleeding in the stool. And those signs start to tell you that when you thought you were over the worst of it, you have to start to think about heading to hospital.
We'll get to the readiness in a few. I want to take it back, Minister, to, of course, the advice for us to ensure our environment is clean. And yes, indeed, I understand that the onus is on the homeowner. But I want to go back to that discussion we had earlier. If you are currently engaging with line ministers, your colleagues, namely Ministry of Trade, to ensure the scrap iron yards are sorted out, namely the Ministry of National Security, to put some ease to all these derelict cars that we would see at police stations, because they also, too, I would imagine, as a breeding ground to trap that water and to create a dengue crisis?
So the answer is yes. There is a steering committee that meets where you have interagency cooperation. But again, Jason, I want to remind you, the main danger is in your house and in your yard. Is in your house and in your yard. That's where we have to focus. All these other things you are saying is true. But the main area of focus, because of Aedes aegypti mosquito flies, what, about 300 feet?
Yeah, about 200 feet or so.
That's where the action is. In your home, in your yard. Yes, you may have a scrap iron dealer. If it's 500 feet away from a housing development, then the risk is much lower. The main risk, Jason, and I don't want to say you're falling into the same trap, but we keep looking at all the other external environmental factors, like scrapyards. Yes, it's a problem. Yes, derelict vehicles is a problem. But the main source of the Aedes aegypti mosquito is inside your house and around your yard. And that is where we cannot give homeowners a free pass.
In terms of the cooperation, is it that we're going to engage these regional corporations to, people always love the spraying, and the spraying in itself creates a whole different conversation, because I know the environmentalists, they're up in arms about that scenario. But what's the conversation like for people who really keep in their space and premises in a total shambles? Are there any legal implications? Could someone get ticketed, charged in that regard?
Yes, so for last year, we issued 1,360 notices for people to clean up their premises under the Yellow Fever Act. And of those 1,360, 82 were really cited to carry on to prosecution. So we are doing that. However, the conversation is on the responsibility of the homeowner. Spraying has a part to play, right? Spraying but you can't overspray for several reasons. One, you overspray, the mosquito builds up resistance to the spray. And then you create a bigger problem. You overspray, it's harmful to human health, animal health, fish and birds. So spraying is methodically and systematically done on a program where Dr. Osafo, Fraser will probably go into some more details.
You could elaborate that.
Yeah, so normally we would spray if we have a couple of reasons to spray. Cases where you have lots of actual dengue cases, we would go in and spray in those areas. Where we have lots of complaints about the fact that we have lots of mosquitoes around. And when we do our own surveillance on a regular basis, which we do on a regular basis every day, our surveillance yields information telling us what's the density of mosquitoes in these particular areas. So when we have those high densities, we also go into those areas and we spray. So spraying is very strategic, very targeted to the areas where we have a lot of mosquitoes and we have cases, so that we don't end up spraying everywhere and create some of the same problems Minister spoke about.
Minister, if God forbid there is a dengue outbreak, there are increased cases, is there a particular plan? Is there action of readiness per se in terms of the bed stock, and where will take care, which particular hospital will be the main focus to take care of this dengue scenario?
All hospitals are equipped to take care of dengue, especially the hemorrhagic cases, which are the most serious ones, where you have bleeding and your platelet counts drop, which is life-threatening. And we did lose 19 people last year to dengue, 19, which is sad. A lot of that could have been prevented if owners, again, had taken a little more responsibility for their premises.
What's the age range, though? I mean, is it extremely young to extremely senior, or mostly seniors?
Yeah, so most of the persons who got dengue during last year, those were people above 20 to 45, that general age
People
range.
in the prime?
Yeah.
Yes. Yeah.
Correct.
Yeah.
Wow.
Yeah.
So 19, you said?
19 deaths last year.
Sad.
Right?
So again, I guess the plan of action is to put the information out. I mean, obviously, other than multimedia, mainstream media, social media, what you plan to go in the community to really have these discussions?
Yeah, so the Insect Vector Control Division and the Ministry of Health, they engage communities, especially high-risk communities, with targeted information so that persons can adopt a more proactive approach to clean their surroundings. A simple thing like a bottle cap can hold over 1,000 eggs. A simple thing like a bottle cap, those blue bottle caps that you see all over the place. A hole in your concrete wall. When people put down blocks and they put them down vertically, and they don't cement over the holes in the blocks, all those blocks all around your wall, those are collection sites, right? Your gutterings, your buckets, and as I said, your uncovered toilet tanks. We found Aedes aegypti last year. You know those aluminum railings for your shower where the doors slide? We found Aedes aegypti eggs inside those railings.
So literally anywhere there's water, stagnant water, they're going to find
Clean, clear, stagnant water.
You know, it's election time, Minister, and obviously we find ourselves, you know, looking at some of these stories via the news cycle. I know you would have given a response, but for those who did not hear, I'll give you the opportunity to say to the Morning Brew audience, or at least respond to the opposition's claim that you're using merchandise paraphernalia to help with the campaigning while you're on the.
We gave out those what I wrote to every member of parliament in November of 2024, offering them in the first instance 100 of those water bottles. And strange enough, more opposition MPs took up the offer than government MPs. We have been giving them out at all health fairs. When we had the prostate screening for men last year, we give out thousands. We give it out in hospitals all over the place. So all MPs have access to it.
Yeah, and I would imagine on the walks, people I guess look forward to some kind of.
But we have been given that out since last year.
And as the TT moves, this TT moves.
Yeah, the TT moves. Yeah.
So is it that I guess it was more or less for everyone to distribute to
everyone? 41 MPs had access to it, and as I said, more opposition MPs. I think seven or eight took advantage of it, which I'm glad for.
While we're there, just give us some details as to your campaigning. How's that going so far?
Well, I wouldn't like to use this forum.
But just, you know, we're in it. So just to get a little.
It's going good, but I'm here with a public officer, you know. It's going good.
Well, that's what we need to know, really and truly. So, Doc, tell me, in terms of the treatment, I know you said, the minister said there is readiness in case, you know, folks present with dengue. I mean, 19 is way too much. We hope there is no deaths at all in that regard this year, but what's the treatment like in terms of severe cases of dengue?
So severe cases will end up in hospital, right? But before you get to hospital, you're going to get all your mild symptoms. So we regularly recommend people use Panadol if you get your pain and fever, not any of the other types of medications like Motrin and Ulfen and those things that people like to use. Those actually contribute to bleeding. So we advise that people use Panadol as a safe one and lots of hydration in the initial stages of the infection. If you get to the stage where you see those warning signs like I talked about earlier on, you head to hospital right away.
Dr. Fraser?
Because at hospital, that's where the treatment will be taken care of.
Sincere thanks again, Dr. Fraser, the Acting Specialist Medical Officer. As always, Minister, I'll let you have the final say.
Yeah, so as far as dengue is concerned, population of Trinidad and Tobago, this fight against dengue and the elimination of the Aedes aegypti is a partnership between the government and yourself, especially those homes, those houses that harbor the mosquito, where you have clean, clear, stagnant water. Please take an audit of your surroundings every couple of days. Make sure you have no containers that are receptacles for clean, clear, stagnant water, because that's where the Aedes aegypti mosquito lays their eggs. That's where 75%, I believe, of the life cycle of the Aedes aegypti takes place, in water, before they mature and fly out. So it's really a partnership between you, the homeowner, the neighborhood, you and your neighbors, and the state. And let's get together, learn from the mistakes of last year, where again, I said the media was misdirected, the dirty green, grassy, mossy drains. That's another health hazard in its own right, but not for the dengue that we are trying to control.
Duly noted, Minister. Thanks as always for making the time to share with us.
You're welcome.
And of course to you, Dr. Fraser. Sincere thanks. Keep up the great work. With that being said, we'll get ready for our second pause inside this first hour, and we come back with prospective Digger Mountain West candidate, Hans Devines. He joins us next.